Welcome to the masterclass titled The Truth Lies Where the Money Hides, Identifying Fiscal Roadblocks in India's Welfare Program. Before we begin, we would like to launch a poll just to get to know you a little better, where you work, where you're coming from, just to give us more of a perspective of who we are addressing. And while you answer that, let me just walk you through what my colleague Ritwik and I want to achieve through this masterclass. Uh, we are trying to give you a different lens and perspective of looking at finances and fiscal roadblocks specifically in the implementation of social welfare programs. Um, in the first day in the inaugural panel, both Nikhil Dey and Professor Joshi spoke about the importance of holding governments accountable to fiscal commitments that they make. Through this masterclass, what we want to do is help you understand how asking the right questions about money, finances, and the fund flow can help make you better informed. So you may be a researcher who's trying to analyze the impact of a scheme. You may be a student who's trying to understand and work on an assignment. You may be an implementing organization embedded with the government and supporting government activities. Or you may be an NGO at the state or district level who needs to understand government processes. And more importantly, as I suppose most of us are, you may be a citizen who wants to know what's happening with the taxes that you pay. So most of you seem to be working in the NGO space, some of you in research organizations, some of you are funding organizations as well. So through this masterclass, what we want to do is uh, tell you how finances may help you understand some of government intentions and government processes better. One way of looking at finances that help us at Accountability Initiative a lot is to think of it as an onion. It's a very layered concept, and peeling off each layer kind of gives you a deeper understanding of it. First, we want to know what the important numbers are. For example, for a scheme, how much money was spent or when was the money spent gives you one perspective of how the scheme has been implemented. Then we want you to see the processes behind that number. Did the money come in late? Why was it spent? Why was less money spent? Was it spent on people's needs? And if not, how come the plans that were made for spending the money were not made properly? But why is it important to understand these things? You may want to know why something didn't work, or to know where the government can be provided support, as some of you are funding agencies that we saw through the poll. Or you may want to know more about the promises that the government made, or you may be a funding program for the helping the government fund certain programs and you're unsure of what to fund and how to fund. There are several ways of looking at finances, and answering these questions and looking at finances help you. But more importantly, like Atishi said today in the morning, it helps us become better informed citizens, and and our, like she said, the being able to vote in like an informed electorate is our privilege, and asking the right questions about finances help us do just that. So to give you a short snapshot of this and to illustrate how understanding finances can be useful to you, we'll take you through a couple of case studies. One of them is the Mahatma Gandhi National Rural Employment Guarantee National Rural Employment Guarantee Scheme, and one is from the health sector. Let us move on to the first case study, which is the Mahatma Gandhi National Rural Employment Guarantee Scheme. Before we begin, let us read a story. This is taken mostly from real life examples, but we decided to give it to you in the form of a story just to illustrate our point better. From here, you can see that Uma and Bela work on their small family land holding most of the year. They are sisters-in-law, and both their husbands and children work in the city. Uma and Bela are both registered for work under the Manrega, but they seek out work only in the months that they do not prepare their field to grow pulses and vegetables. Their husbands and children send money, and also with the money that they get from selling these vegetables and pulses in the market, they often it covers their monthly expenses, and they often earn more than what they get as daily wages under Manrega. However, there are other bureaucratic issues because of which they are a little reluctant to bank on Manrega. One is that work is often erratic. It is not available when they need work. And sometimes wage payments are delayed. Bela, for example, is yet to receive her wages for the work she did last year. This year, both women have been in complete distress. Their families have lost their jobs in the cities and have moved back into the village, and they have all applied for a Manrega job card. Uma's husband is still awaiting a job card, and Bela's husband has got one, but still there is no work in the village. Uma's daughter is a high school graduate, and she was learning to become a nurse, but now she's also lining up to do manual labor under the scheme. Before we move on, let's launch a small poll just to ask you, what do you think are the 2 to 3 problems which Uma and Bela face under the scheme? We'll give you about 30 seconds. Some of the typical headlines that one can see with regard to Manrega are there on the slide. And this brings us to one of the most important questions you can ask when it comes to finances, the allocation versus expenditure story. As you all know, the Manrega is a welfare scheme that guarantees 100 days of paid work to rural households in a given year. It is a demand-driven scheme, which means that the spending depends entirely on the work demanded by the rural laborers for the year. The demand is usually estimated before the budget so that an appropriate amount of money can be allocated to the scheme every year for the budget. Why do you think Uma and Bela found employment provision to be erratic? This brings us to the allocation versus expenditure question. But before we do that, let's look at the results of the poll. What you think are 2 to 3 most important problems that they face? All of the above is what 71% of you think. And let's go by the options one by one. Some of the typical headlines associated with Manrega over the years have been those around record-breaking allocations. For example, if you go to the next slide, we can see that in 2019-20, the government allocated rupees 60,000 to Manrega, which was the highest allocation ever made under the scheme at the time. However, since Manrega is a demand-driven scheme, what is important to note that the government had actually spent more the previous year in 2018-19, more than 60,000 crores, while its allocation was 55,000 crore. Often some of the criticism for Manrega allocations has continued to be that of subdued expectations. Most often than not, the government ends up spending more than the estimated allocations for the year. As you can see, the red bars are always higher than the gray bars. Yet, most years, these estimated allocations are announced as historic allocations despite the underestimation. Even in a year like 2020-21, when the expenditure has been more than rupees 1 lakh crore, groups such as the People's Action for Employment Guarantee believe that in order to extend relief work at a time like this and to guarantee 100 to 150 days of work for people registered under the scheme, we need to allocate double the allocation that we have made under the scheme right now. Going back to our story, even in a small village like Uma's and Bela's, the Panchayat found it difficult to provide work for everyone because the demand estimation for most years is inaccurate and usually estimated on the lower side. So this brings us to the important point of whether just looking at one number is enough, or one should go down and investigate financial numbers to bring out a story of what a scheme when it comes to money allocation and expenditure is telling us. The second point that we wanted to bring out was the issue of delayed payments. This is another headline that's often associated with Manrega. What is important to note is that Manrega has a very improved and efficient information system. This has improved significantly over the last decade. The scheme has developed a management information system, or the MIS, which has made tracking of public funds extremely easy and transparent, even for the average citizen. Updates are made state-wise in real time, and one can see the progress over the years because data of previous years are maintained along with the new. The MIS for Manrega is often considered to be the model MIS for a lot of social welfare programs in our country. Despite these changes, the Manrega experience has often been found to be very different on the ground in different villages than what the MIS says. In fact, several studies have found that payment delays, for example, which has been one of the key areas of improvement under the scheme, is very different from what one can track via the MIS and what actually happens. Recall from our story how Bela was running around to receive payment for work. Why do such delays occur? Very recently, a study conducted by the Azim Premji University in collaboration with other research institutes showed results that prompted the Supreme Court to get involved. The Manrega has a provision that allows compensation payment in case of delay in paying daily wages. This is usually 0.05% of the actual wage earnings. So, if a worker is not paid after 15 days of her or his work completion, he or she is to be compensated by not only the wage payment that he or she is promised, but also 0.05% of the daily wages for each day of delay after 15 days of work completion. However, the official process of calculating a delay often overlooks certain steps that contribute to actual delays in payment. Let me elaborate a bit on the two-stage wage payment process, which you can see on the slide. The central government has centralized the payment system of the employment scheme. The state has no power to pay wages to the workers, even if it wants to. The center brought in the National Electronic Fund Management System, or the NEFMS, as per which, on completion of the work week, a fund transfer order, or the FTO, is prepared at the block or panchayat level. This is an electronic pay order and is digitally transferred to the central government once the work week has been completed and all the details have been sent. So you can see from stage 1, there are 2 FTOs that are generated, which completes the first stage of payment. The second stage involves this payment to be transferred to the bank or postal account of the worker electronically. As you can see from the slide, this stage also involves multiple steps and requires the coordination of several stakeholders and signatories before the wages are finally deposited in the workers' bank accounts. The MIS, however, what is important to note, counts the delay only from steps 1 to 5. No matter how long it takes for steps 6 to 9 to actually take place, the MIS does not register such a payment as a delay. This has created a huge discrepancy in the calculation of compensation wages paid to workers for delays, leading to massive undercalculation. If you look at the data, what does it say? In 2016-17, for example, the study that we formally mentioned found that only 21% of payments were actually made on time. In response, the Supreme Court issued an order asking the Ministry of Rural Development to investigate the reasons for payment delays. MORD asked states to submit the details of both stages of payment. From the data on the left, you can see that this is what the MIS says. 2017-18 onwards, there was a significant improvement in the payment of funds to workers. 82% in 2017 was paid on time within 15 days, 87% in 2018. However, when the MORD asked the states to provide data for both stages, one can see that there is a discrepancy. For most states, stage 1 happens more or less on time, as you can see for 2018-19. But stage 2 is often quite delayed. States like Karnataka or Bihar show quite the contrast between the payments in stages 1 and 2 respectively. This has led to massive dissatisfactions with the scheme in many parts of the country. Some workers are still awaiting payments that were due to them. In the case of Uma and Bela, they too chose to work on Manrega only in the months when no other work was available. Workers are therefore reluctant to bank on the scheme unless absolutely necessary. However, the scheme continues to be the foremost rural welfare program, with demand remaining still very high. Because despite the dissatisfaction with wages, it is still one of the few opportunities for guaranteed and paid work for rural labor. In the interest of time, however, I would skip my next segment and ask my colleague Ritwik to come in and talk about the health sector.
So now let's speak a bit about the health sector. And in this short case study, just as the previous one, I think the important point is processes and how processes are really important, especially when you're looking at finances and how that weaves into the general implementation story. And over here, we're going to discuss issues specifically with planning, with releases, and with expenditures. And this is crucial to understanding implementation gaps in various social sector programs such as health and education. Uh, so with healthcare, I think the one thing that's been on everyone's mind at the moment is the ongoing COVID-19 pandemic. And in more ways than one, COVID-19 has exposed a lot of flaws currently with our healthcare system and with governance in general. One of the things that has been repeated several times by experts has been that we really need to increase the amount of funds we give to healthcare. Right now, we give about 1.5% of GDP, which is spent by union and state governments together. But really, this is not enough compared to other countries which spend 6, 7, 8%. And double of what the union and state governments spend is what is spent by citizens out of their own pocket. And there have been commitments, of course, by governments to increase this as well, especially noted in the national health policy. But let's ask a slightly different question here. Once an amount has been set for a year, what happens with that money? Even if you're planning with a very limited amount, does it really get spent? And this is an example from the health sector in 2018-19. And take a look at this total budget available for the National Health Mission. So this includes the budget that they were allotted for that year, as well as the previous unspent money that they had for health. And compare this with expenditure, and you can see that there is a very big gap that exists between the two. And why did this gap really happen? And we have a very short question for all of you in the form of a poll once again, just to get your thoughts on why you think this gap exists in the middle between a total budget being allocated and total expenditure. So while you guys answer the poll, let's take a look at maybe a problem, a certain kind of problem that one sees in the health sector, and use that to go forward. So let's imagine that there's this person called Sitama, and she lives in a village. She's noticed that there was an outbreak of malaria a few months ago, and that the local health center, or the Prathmik Swasthya Kendra, primary health center, is not staffed. There are no doctors and nurses over there. And several people have fallen sick. Therefore, they don't have medicines and have to rely on expensive private care. And there are travel costs as well for those. Incomes are typically very low. And borrowing for meeting healthcare costs is a source of great stress. And this has really been bothering them. And they decide that they want to do something about it. At the same time, there is a local NGO working on children's health, which has also been alerted about this issue. And they've joined forces and they've joined the cause. And they all want to work together to try and make a plan to solve the problem. Okay, most of you think that there are delays in money being sent and there are leakages in the system. So let's hold on to this. Actually, this is really interesting. So one way for these guys to solve this particular problem of this malaria outbreak would be for them to all come together and make a plan to tackle the problem. And very luckily for them, incredibly luckily for them, the National Health Mission, under which these primary health centers operate, there is actually scope for making a plan, at least in theory. And the National Health Mission aims to achieve universal access to healthcare by strengthening health systems, institutions, and capabilities. So let's talk about what this planning process is, because in theory, there are mechanisms that should be able to help this village articulate what they want and also for their needs to be met in a concrete and tangible way. So the National Health Mission advocates for an annual decentralized and aggregative budgeting exercise to help determine targets and to help decide, okay, where do we want to spend our money? Do we want to spend it on this? Do we want to spend it on that? What do people really want? And these are called village health action plans. And these are supposed to be prepared in consultation. This is important, in consultation with the local community by these groups and committees called the Village Health, Sanitation and Nutrition Committee, which were also mentioned briefly in the previous section. These committees are meant to take collective action on issues related to health and social determinants, which are non-medical factors such as access to health, at the village level. And in particular, they support the process of decentralized health planning. The committee is to take leadership in providing a platform for improving health awareness and improving access, as I said earlier. And they have to address specific local needs and serve as a mechanism for community-based planning and monitoring. So you can see there's a lot of community involvement. Everyone's supposed to be together. Everyone's supposed to monitor their own services. Yesterday was an excellent masterclass which spoke about disentangling decentralization. And the main point is who should do what. And over here, it makes perfect sense. The people should decide what they need at their level because they have the best vision for it. Now, this committee is at the village level, of course. It's supposed to be a subcommittee of the Gram Panchayat. And the committee obviously should be representative of all the various social groups and castes in the village. Now, these village health action plans are supposed to be aggregated and brought together into block health action plans, which are further combined into district health action plans and then into state program implementation plans. I know it's complicated, but just look at it as a state plan or an SPIP. And then, of course, all these SPIPs are put together and there's a union government plan. So all of this is lovely. It's excellent. But as some of you from the poll, it's visible, some of you realize that this operates a bit differently in practice. So let's take a look at that. Now, some studies that we've conducted found no evidence, unfortunately, and sadly, of village and Gram Panchayat level planning. The planning process actually was found to begin at a level above or 2 levels above, at the block level or at the community health center level. And even this lacked any groundwork or fieldwork to assess local needs. So villagers weren't really being asked what they need. People weren't really being asked what they need. So in reality, Sitama, going back to Sitama, her opinion or that NGO's opinion probably won't be taken into account at all. So what really happens? How is the plan actually made if you're not doing it in a decentralized way completely? So the block program manager, one of them we spoke to, said that we fill up this Excel sheet as sent by the districts. We make estimates as a 10% increase from the previous year's budget. So instead of actually accounting for local needs, this functionary was told and ordered, so they also couldn't do anything about it, was told to just increase each item by 10% without really changing the composition, even if a change was needed. So even if you needed more money for malaria, you couldn't bring that in. And local needs are completely different here. And I think that's the bottom line. And you can see that the same is the case at the district as well. So the district accounts manager said, well, state officials know what we need. Our proposals get modified by the state, and we usually increase our budget by 10% from the previous year. And this is known as incremental budgeting, where the previous year's budget is simply increased by a set proportion. Now, how is this useful? And do NGOs and other organizations really have this kind of information? Yesterday, Chakshu, in the session on building knowledge, skills, and attitudes for effective government engagement, mentioned that there is a gap in understanding among a lot of people in civil society on how money flows happen. And AI is trying to bridge some of that gap. So even if the plan was made while including everyone else in the process, it's likely that orders aren't going to be taken seriously, as planning from the top is going to dominate anything, right? So any NGO trying to support planning in states will have to do so at every single level. Because if you just strengthen village level planning and you work with just at the grassroots, then one is likely to get frustrated, and take the example of Sitama's village. They probably made a plan, they tried really hard, they got so far, but in the end, it didn't really matter. And this can be a very heavy feeling to deal with. What are some of the other problems that we see? There are typically significant delays in the planning process, even up to the stage of approval, final approval for the state plan, sorry. And what we see is that the entire process gets delayed. So October and November is when you see the planning process beginning, and each stage takes a few months, and the district health action plan takes 3 months. So as a result, final approvals for a state often arrive only towards May and June, impacting the implementation in the first quarter, which begins from April. So April to June, you don't know how much money you have. Therefore, the planning cycle is not in sync with the fiscal year, and that's an issue. So even if this wonderful plan is made and taken up, implementation gets delayed. And remember, this is the health sector. There's a malaria outbreak. There are lives at stake over here. And this is something that whoever you are, an implementing organization, a technical support partner, a funding organization, you might find very useful. So we know that planning is top down instead of bottom up. But what happens with fund flows? And there are delays here as well. So for a second, let's assume all these plans have been made perfectly. They've gone up the chain. Wonderful. Everything is perfect. Now, the first thing to understand is that for centrally sponsored schemes, which are funded by both the union and the state, the union government takes a leading role, but the state is implementing the scheme. Now, there are several links in the chain. First, the money from the union government goes to the state treasury. The state adds its own share because it's shared. And from there, it goes to the state health society for health. Okay. Then from the state health society, it goes to the district, then to the block, and then to the front line. So we mentioned Prathmik Swasthya Kendras or primary health center. So that's the front line that we mean. So you can see at least 5 links over here. Right. Now, there are some rules and regulations for fund releases, which CSOs also have to follow. And for example, the union government will not release in further installments if the state hasn't given its own share. Or the union government will not release money if the state has not spent its earlier share and shown that they're spending. And that makes sense. Why will the union government release more if the state isn't adding their own money or spending their own money? But at the other side, states which are in a tight spot, in a resource crunch, especially due to COVID in these very strange times, they're going to find it very, very hard. Uh, and they end up losing out on crucial funding for development in this way also. So this is a complex challenge. It's not simply to blame one person or the other, or state or union, really. Now, if states are now what we have over here is a very interesting example to show you about the extent of delays. We know that there are at least a few transactions required, and even if one link breaks, the chain breaks. So for the National Health Mission from in 2015, 16, and 2017, 18, there were massive delays in just the second transaction between the state treasury and the state health society. And if you look at Telangana, it took 287 days from money just to go around in the state office, and that's 3/4 of the entire year. So, but in 17, 18, they sent money quite instantly in the same day, 0 days delay. So it's very doable, and we know it. But even some other states, you can see Bihar, Jharkhand, Punjab, Uttar Pradesh, Rajasthan, Uttarakhand, there were delays of more than 100 days. And that's a big, big challenge. And if so much time goes in one transaction, then two things are implied. One, either money is reaching districts very, very late, or it's not reaching them at all in that financial year and it's reaching them in the next year. So it's important to ask, why does sending money take so much time? And why is it so complicated? And there's one very simple answer for you: paperwork. So paperwork is what leads to significant delays in fund flows. And this is something that our research has shown us. So one thing is that processing includes multiple people approving the transaction or adding other details to it. So it goes from one desk to the other desk to the other desk. And once staff in the finance or account departments approve things, senior bureaucrats at a given level also need to approve them. Secondly, so there are two things that we found. First, that the most amount of time went in processing and transferring these files. And secondly, funds often get released by activity. What does this mean? This means that funds are released specifically for strengthening primary health centers, strengthening capacities, so training programs, and for different activities, for procurement of various tablets, for medicines. So it's sent in these different things. So in one state, we found that there were over 900 transactions made between states and districts. And obviously, India has 700 districts, right? And this is just one state we're talking about. So there are so many different transactions happening. And one question to ask: why can't all the money for that district just be sent together? Why complicate it so much? And this adds to workload, this adds to delays, and therefore money reaches districts very late and often in the last quarter. So we see that state health societies, they receive 50% of their funds in the last quarter in these two financial years, and then they have only 3 months to spend half the total funds. So it's really challenging, and then they're just running around trying to do it, as this quote on the screen also tells you, that they just try to meet these targets, but often things do get missed out. And one really can't blame those officials at the bottom level, because they're trying their hardest to try and get things done. So I think one point to make here is that it's not just leakages. Of course leakages exist, but it's not just that. There are these other challenges that are really complicated, and whoever said delays in funds going, well done. Congratulations on answering that correctly. That's definitely one problem, but of course leakages are also a problem, and there are several different things. You can make arguments for all four of those options that we had given earlier. Now, when money reaches very late, it's hard to spend, and this adds to another problem, that of weak capacity. Typically, these block officials, there are vacancies. So often one block official has to do a vacant block official's work also. So this is double the work that they have to do. And this is called having an additional charge. And you see this in nutrition especially. And this is just adding to the level of delay that already exists. So districts and blocks don't get what they want always. They don't know how much money they're going to get until the financial year is over. And since they don't know how much they're going to get, and they've seen, okay, my plan isn't going to get accepted, then it's very hard to even make that plan to begin with, because they don't know when they're going to get that money. So this uncertainty really doesn't help with planning. Now, these processes are informative in so many ways for all of us. For Sitama's problem and this village's problem to be resolved, making a plan clearly isn't good enough. And the machinery to implement that plan must also work well. But we see that this isn't always the case, as you know, and any organization that trying to implement plans in a better way, or is trying to work with government, or is wondering why spending isn't happening, or if there's a funding organization looking to fund new programs, and they must keep in mind, that states are often unable to spend due to several other reasons. This information is particularly useful for you while making your plans. And say an NGO is trying to create a new medicine and they haven't accounted for these, then there are going to be unanticipated delays. And once again, you're going to be feeling frustrated about it. Now, and one should also, of course, think about capacities and the amount of paperwork that's related to this. And I think one of the big things is that processes are absolutely crucial, and low expenditure, while commonly believed to be a function of leakages or corruption, is often due to other reasons as well. So they're all put together. And we've highlighted just some of those. And this is just a snapshot. If you go into some state and start doing a deep dive, you will find something different, but there will be a connection and you'll see that. But one question that we should ask, is spending and finance all we should look at, or is there more? And let's perhaps look at a couple of quick examples. So the first example, this MNC multinational corporation organization, sorry, not corporation, tried to build taps in a village where women had to go really far to get water. Very nice. Within a week, they realized that the taps had been broken. They built them again. They came back. They realized they're broken again. So what happened? Actually, the women themselves broke the taps, because for them, the pilgrimage to go get water was actually a moment of freedom for them, away from the home, away from the house. And doing a needs assessment, therefore, is very crucial when one is trying to plan and one is trying to fund. And we're assuming over here that everything was funded on time, and planning finance worked well. But one also has to look at things beyond finance at times. The second example is from ICDS, India's Integrated Child Development Services. And in some parts of the country, we've been able to provide take-home rations absolutely on time. And over for this, we need calories and proteins. But in some places, pregnant women aren't allowed to drink milk. So the estimation for how much protein should be put in the take-home ration is off for that area. So we need to rethink that. So cultural, behavioral, and political questions are very important, as has been highlighted through this wonderful conference that we've had. Some of the key takeaways for you, and I'm just ending in 2 minutes, is that we've given you a snapshot of some of the issues, and we know that following the money is crucial. We've learned that we shouldn't just go by headline numbers, and that looking at processes, especially as we saw for Manrega, and following the money is so important, and to understand why things work and why things don't work. Another thing is that underutilization is not equal to only corruption. And the point here is that low spending could be for several reasons. And we've given you just a little bit of a snapshot. And there's a 20-hour course that AI is also hosting. Check it out on our website, that actually does talk about this. Some of the reasons that we saw included cumbersome processes, low capacity, and this differed across sectors such as health, nutrition, and education. And these structures and processes for each are different, and they also differ across states. Keep that in mind. So there's no one answer to tell you why utilization is low, and there's a lot of variation. So it's important to peel away these layers of the proverbial onion that Meghna started with. And looking at planning and budgeting processes in practice is essential. In practice, one of the main reasons is that this tells us where decision-making power really lies. And this ties back very well with the previous masterclass, which spoke about funds, functions, and functionaries, and who should do what at what level. Lastly, we should continue asking the right questions. While we did acknowledge on the previous slide that there is more than finance, finance is one thing that is understudied, and we should really be studying this as a major block in the implementation problem. And we have several gaps in our understanding, and bridging them is absolutely essential. And do follow some of AI's work to see a bit more of what you saw today. Following the money also gives us a specific lens, that this is a lens that we're looking at the next time we go and make our plan, the next time we try and do something in any state and work with government, this is something that we have at the back of our head, and we look at the problem from this lens as well. And this is absolutely essential, and we really hope that this is something that is left with you at the end of the session. Now, very lastly, just to not just give you a lot of information without telling you how maybe you can also do some of it. So there are several things that one can access or look at. There are budget websites and documents. There's the union budget website, which has information on how much is allocated for each scheme by the union government, how much tax has been collected. And of course, state budgets, as Chakshu again pointed out rightly yesterday, are something that are again understudied. So do look at state budgets as well. And the formats are all very different, so you'll have to manage, but do look at state budgets. We have scheme data sets, which give us information on targets and so on. And for example, the Manrega dashboard, where Meghna brought a lot of her data. We have audit reports by the Comptroller and Auditor General of India, which are again a useful source of information, and they monitor the government quite well, and helps us understand various issues. And then of course media is there, but often media researchers and other people do get this wrong. We don't really understand how to do this very well. So it's always important to double check and triple check before one goes out, because it is confusing. There are no ill intentions here. People do get confused. We get confused often, and we get calls about it. So just look at multiple sources and check them carefully before making conclusions, and often different sources also say different things. And lastly, just to finish this masterclass, we can't emphasize enough how important it is to speak to people, to the Manrega workers whose payments are delayed, to Uma and Bela, to Sitama, whose village have faced a malaria outbreak, to the block and district level officers who face several constraints in delivery, and it's not their fault often, and to other stakeholders as well, including other NGOs, government themselves, obviously, supporting partners, and so on. And we really hope this session has given you something to think about.